Another thing important he mentioned, he had to carry to the hospital by wheelchair. That is also important thing. He was not able to come himself. So that indicates some severity that you should calculate. Then he received some injection. Already he has mentioned melena.
Yes.
Do you know what is melena? Melena, what is melena? Blood stool, blood stool. What are the sources? Upper GI tract. Upper GI tract. Upper GI tract, possible causes, areas, diseases. Upper GI tract, agree.
Yes, sir.
What are the diseases from where it usually comes commonly? Peptic ulcer. Yes. Peptic ulcer disease. And melena may be due to peptic ulcer disease. So peptic ulcer disease was his presentation then, earlier. That is, and he had to give transfusion, blood transfusion. So that was severe in his age, early age. So that was severe. So he had history of melena due to some hemorrhage. Most likely, commonly, about more than 60% of this melena is due to peptic ulcer disease. And peptic ulcer disease, when anybody asks you peptic ulcer disease, then this is the area you should know where this ulcer usually occurs and what are the different types of ulcer, whether it is benign or malignant, and which ulcer bleeds and which ulcer perforates, right? You know it. So when ulcer in the anterior wall, then of duodenum, which part of the duodenum? First part of the duodenum. When the ulcer in the anterior wall, chance of what is more? Chance of perforation is more. If it is the posterior wall, chance of bleeding is more. So from his history, it is calculated that he had melena, most likely peptic ulcer, and it was ulcer in the posterior wall of the first part of the duodenum, right? So that is the one information we are getting. Now we are in the history now. Then in present history of present illness, we are more or less, we have concluded that. Now due to lack of time, I am not going in details of taking history. The way, just segment I have just tried, you just follow this, you give maximum time over there to know everything. In case of female ministerial history, everything, familial history, everything, and other family history also, any drug history, any habitual, what he is taking. বিড়ি সিগারেট খান আপনি? খান না, কোনো নেশা টেশা করার অভ্যস্ত নেই, পান টান খান একটু, আচ্ছা এটা, উইথ দ্যাট ইউ শুড আস্ক ইট. So that is another issue. Then you will come to the patient proper, which is you have to practice every day, every time, every moment. What I am going to share to you, how important this clinical examination is. Somehow you will cross the MBBS, no problem. With the mercy of your student, with the help of your associates, somehow you will cross, no problem. But if you remain simple MBBS, you will be burdened to yourself. Nobody will ask you for a treatment. Now the situation is like that. Your position is lower than homeopathy doctor now in the community. Yes, that is the reality. MBBS is the foundation. On this MBBS you should become a doctor. That's why what I am sharing with you, my elder son, when he went there, he had to learn this clinical examination himself, but abroad patient is not that available. So his wife is also doctor over there, and they practice themselves. Wife became patient, husband became a doctor. Husband became patient, wife became a doctor. That way they practice, that way they reconstruct their clinical fitness, that way they cross the stages. Now they are fellow over there and they are doing alhamdulillah better. So the thing is that difficult. So now if you do it here, it will be far easy for you to reach there, but unfortunately we don't follow it. Situation is so easy for you if you open your net, you can get everything. The real picture you will, how a student of clinical in AMC or in any other place of the world, how they approach the patient. You open, you will get it. If simply follow that thing, you will be a master. But we are not concentrating over there. We are simply concentrating our theoretical knowledge, but not practicing the clinical one. That's why the message is that I am just giving this thing message to you, as because so far I have selected, you are more conscious, more confident on yourself. That's why you can get this message and you can transmit this message to your friends. Now think is that these 10 students will be given some another 5 or 6 students in your group, and you will learn it from here. What you are learning, you are just giving to your friends. So if you can do that, your knowledge far better than your friend, because when you are demonstrating, that will give you extra confidence. Yes or no?
Yes, sir.
That's why you just get information from here, then definitely your friend will ask what information you have got. You just try to ventilate them the way you are getting from here. In clinical examination, you know, here we are not giving you the theoretical discussion. Directly you should go there. But why you are going, how you should go, that we should know. That's why I am talking to you. That can be done in that place. But this is the place where you are getting the patient, this environment, this movement, this scenario, everything will remain in your brain. That's why you have to come over hospital, you have to come over. This talk, I could do that there, but that will not be helpful for you too. That will not be in your brain. The patient is there, I am here, and you are here, everybody is here. This scenario will give you some impression in your brain and you will not forget. That's why. So we are not giving much time in theoretical discussion, we are concentrating in examination. If we examine a patient, first you take consent, introduce, then you go for general examination. General examination, and mostly we are concentrating, most examination is related with which part of the patient? Abdomen. Yes. So we will just start that. Before that, we should go for general survey. General survey. General survey, as you know, you need a body build, it is fine. Patient is decubited, it is fine. Patient is lying condition, patient is cooperation is good, and communication is good, and his lie position is as it is. He was sitting, now he is lying as per instructed, and from that point of view, everything is fine. Now, if you see for general examination, number 1 is inspection, already I have mentioned. Number 2 is after inspection, what will be the next?
Palpation. General examination.
Now, what about the general examination? General examination, okay, but if you categorize the sequence of examination, as you was telling, inspection,
Palpation, percussion, auscultation.
Now what you are telling, it is wrong. Why wrong I am telling? What you are telling, inspection, palpation, percussion, auscultation. This is wrong. Our time that was, even in your time with you it is, but this is not accepted now. Why? Especially in case of abdomen. I am talking about abdomen. In case of abdomen, as because abdominal examination is more common. Inspection, okay. After, I am talking about abdomen. Inspection is fine. After inspection, not the palpation. Because after inspection, if you go for palpation, if you palpate the abdomen, you will stimulate the structure over the abdomen and gut also by your deep palpation. If gut is touched by somehow, the peristalsis of the gut will be changed. So immediately after inspection, auscultation should be there. Am I clear?
Yes.
Any question?
No, sir.
Because if you handle the abdomen, the bowel sound movement will be changed. That's why in case of abdomen, inspection, auscultation, then palpation, then percussion, you can go. Okay?
Yes, sir.
Is it acceptable?
Yes, sir.
If anybody asks, it is changed. Why? If you are not convinced, nobody will accept it. If you are convinced, yes, if you handle the abdomen, bowel will be stimulated, movement of the bowel may be changed. So in case of abdomen, first of all, we should go for inspection, then we should go for auscultation, then palpation, then palpation. Okay? Now, in general examination, if you want to see the basic, you should start from general examination from hand, right? Sometimes question asked, what are the information you will get from hands of a patient, right? So, এরকম করুন তো হাত দুটো আমার মত এরকম করেন, হ্যাঁ এরকম করেন, এরকম করেন, হ্যাঁ এরকম করেন, হ্যাঁ. What we are seeing, we can see the. No. This is not the thing of clubbing. Nails. That is the colunica or leuconica. That is one thing. This way. We are seeing the palm. Okay. This palm. What are the information you will get? Palmar erythema. Another is jaundice not there. Anemia not that much, but not that much. Another is dupuytren's contraction. One is palmar erythema. Another is dupuytren's contraction. Do you get me?
Yes, sir.
So that is the here. And then as you are telling, আপনি আমাকে এরকম করবেন একটু দুই আঙ্গুল এরকম করবেন এই হাতটা সরান হ্যাঁ এইরকম. So if you see এই আমি যেরকম করছি আমি যেরকম করছি না এরকম করেন. You see what is that?
Window test.
What is called? Clubbing. So that is another. So in another thing when it is here, then another thing information is tremor. That also another information. That also you will get from hands, right? And that is everything from inspection, not even palpation, right? Everything inspection. Then you will see inspection what information about eye. তাকান হ্যাঁ যখন তাকাবে one thing you can see whether there is ptosis. Ptosis is not there. Movement of the eyeball is fine. আমার হাতের দিকে তাকান হ্যাঁ এদিকে তাকান আর ওইদিকে তাকান everything is fine. No nystagmus. You can উপর দিকে তাকান উপর দিকে তাকান. What is called lead lag or lead detraction? Can you follow me?
Yes, sir.
So everything you are getting from here, right? আপনার জিহ্বাটা বের করুন তো বড় করে বের করুন হ্যাঁ জিহ্বাটা বের করুন হ্যাঁ ভিতরে নেন হ্যাঁ. We are in inspection. So you see the eyes, you have seen the tongue. In tongue, color of the tongue give you the anemia or not anemia, furring of the tongue, coating of the tongue, bifurcation of the tongue tie.
Yes.
These are everything you can see from tongue, right? Then you can go for other general information about the patient to see whether other areas, especially any obvious swelling of the abdomen, right? Any either lymph nodes or any swelling that you can go for a survey. And then that swelling may be in the inguinal region, maybe in the axilla, maybe in the cervical region. So most important thing is that you should go for inspection. After inspection, you should gross. I am not going in details. Now you go for palpation. In palpation, in general, you should examine the whole lymphatic drainage area. মানে একটু বসবেন আমার জন্য হ্যাঁ এখানে বসেন হ্যাঁ এখানে বসার পরে if you see the lymph nodes, mainly one of the important thing is examination of the cervical lymph nodes. Before going for examination of cervical lymph nodes, you should go for segment to segment, right? Area by area. একটু এই টুলে আসেন একটু টুলে বসেন. And this examination, very important examination, is examination of the cervical lymphadenopathy. In that case, your theoretical knowledge is very important because these lymph nodes are distributed in different groups, right? So that's why when you and your position will be back of the patient. Okay? And first of all, what I am doing, I am just examining the submental region. Then I am going to submandibular. Then I am going to zygolodigastric, right? Then I am going to the anterior chain, then supraclavicular left, right? And left supraclavicular why?
For the gastric carcinoma.
Yes, for carcinoma, the metastasis. So That's why this area is very important. Then will you go back posterior and you will go back downwards and ultimately you go posterior chain, ultimately preauricular and postauricular. Then you go for preauricular, then you go postauricular, and then you go posterior chain, right? After that, this is the sequence of examination. Now you know it theoretically, but if you don't practice, you can practice, without practice never will be able to do that. That's why you need practice and practice. This is way, this is way, this way, this way, the preauricular, postauricular, posterior chain, and go downwards. Then you go for axilla, then left axilla, right axilla. If you go for axilla, suppose in this way, how you will be able to do that? This is the way one, this is the way one. You can even this technique, what I am telling may vary from person to person, but you go through some basic Hamilton belly or Norman brows or McLeod's, whatever the thing, you will see that basic you stick to that. Thing is that yes, if you want to use your right hand, then it is not always possible. Go there, this way, that should be relaxed. That should relax, that we rest over here, then you use this hand, then you palpate this axilla. Okay?
Yes, sir.
Axilla. Again there is some group, anterior group, posterior group, posterior medial group, lateral, apical, and systematically. Same way you can go in that way also, in that way. And it should be anterior, posterior, apical, lateral, and it should be practiced like that. Okay? Now you go for anemia. This is the anemia, this is the anemia. Upor dige takan. This is the jaundice. Okay? This is the jaundice. Okay? Now if you want to see the cyanosis, if patient is fair enough, your tip of the nose is the area, not necessarily press, color will see you, that is the cyanosis. Cyanosis again, it may be central or peripheral. And tip of the tongue, jibra bar karen? Tip of the tongue is also see whether it is central cyanosis or not. Now after lymph node, then you can go for downwards and inguinal lymph nodes and everything over there. Then what we are going to demonstrate, the abdomen proper. That is important. That we will go for abdomen proper. Now what you are observing, I am not using this tool. I am not allowing you also use this tool, because that is also one part of training. I am with fracture of my fifth metatarsal right. This position is not comfortable for me, but still I am taking this trouble only to demonstrate that this is the way. If I am sitting, you are standing, somehow you will not feel comfort. I also not feel comfort. That's why this is one source of training. When we stand in operation theatre, we have no option to count time. 1 hour, 2 hour, 3 hour, 4 hour, 5 hours even. No way to take rest. That's why as a doctor, that is also one part of training, to remain this sorts of standing position. Some of our students, they cannot remain stand, even they fall down and head injury I have seen. But you should practice yourself, as because you are in this area, you have to, like that's why I was telling, change your calendar. Your calendar must be changed. Otherwise you should not be in the field. You should quit, do something better than this. But if you are here, you should change your calendar. That I have mentioned in the morning.